good morning to all of us all over the world because I believe not the participants are not just coming from the Philippines but all over the world. And to start, before we start this live webinar, may I call on Miss Cherry Ampig, Izana Philippines General Manager, all the way from Salt Lake City, Utah. Hello, Ma'am Cherry.
Hi, Nina. Thank you so much. And hello, Kay June. Good morning. And
Hello.
I'd like to say thank you on behalf of the USANA Philippines Associates and employees for giving time or making time for you to be with us this evening here in Salt Lake City. So magandang umaga po sa ating mga associates and guests na who are all logged in this morning. We still have space right now here in our WebEx call. So if you know anyone who you think can benefit from this training, share the link to them and make them log on and join us here sa training natin ngayon. And very exciting ang training for today. We are going to talk about, well, not me, but Cajun will be talking about the science behind Celavive. So this will be more an in-depth training regarding Celavive, I think my most favorite product here in USANA. So I've been using it personally for I think the past 4 years, because even we have started to launch it, we have already been testing it in the market, and I have really been so happy about our product, Celavive, and there was never a day or night that I have not used this product. So you will hear directly from the person who actually works on the formulation of Celavive. So I will not give you any make you wait any longer. So I'm going to throw it back again to Nina so that Nina can give justice to intro properly our esteemed speaker for this morning. Back to you, Nina.
Thank you, Ma'am Cherry. And so before we have our live webinar, I'll be introducing to us our speaker, who is the Director for Product and Development. She is a licensed pharmacist from Japan, and she has previously worked at a biochemistry laboratory researching new antibiotics, as well as one of the leading trading companies in Japan, where she was in charge of the formulations in nutritionals and personal care products, also overseeing regulatory affairs and product development. Ms. God joined USANA Japan in 2003 and has since relocated to the USANA's home office in Salt Lake City, Utah. Her latest accomplishment is Celavive product development, and she currently focuses on the Celavive extension as well as nutritional for women's health. Let us all give a virtual welcome to Miss Cajun Ko. Hi, Ma'am Cajun.
Hi, can you hear me?
Yes.
Oh, good. So, hello, I am Keijun Ko. I am a pharmacist in Japan and Director of Research and Development in USANA. I'm very happy to meet you all via WebEx tonight, but today, but hopefully we can meet each other in person sometimes near future. So remember, USANA R&D team will continue to support all USANA families, especially under such a difficult times. So let's start Celavive science-driven skincare. So today I'd like to talk about skin briefly, and then current Celavive product line, as well as newly introduced Celavive product in the future, and then Celavive clinical study conducted last year. So let's quickly review how cosmetic works on the skin. Take a look at this cross section of skin tissues. The skin consists of three major parts: epidermis, dermis, and hypodermis. Hypodermis is underneath of dermis, so it doesn't show in the slide. The skincare ingredients target on epidermal layer and possibly dermal epidermal junctions just above the dermal layer. And skin product always containing humectants such as glycerin, sodium PCA, and butyrene glycol, pentylene glycol. Those go into outermost layer, called stratum corneum, which is a very tough, hard keratin protein made of like a bricks, and works as a great moisturizer and deliver active ingredients. So humectant is very important, and then humectant give a moisturization on the top layer called stratum corneum. And then we sometimes use liposome nanocapsules and other active delivery systems that goes into a little bit deeper into the epidermal layer from middle to toward the bottom of epidermal layers. And then Celavive product, I know you guys already using it, especially in the gray bottles, contains cell signaling complex, which is expected to work on the epidermal-dermal junction, where a lot of cell communications are happening. And the cell signaling complex itself will not be absorbed into dermis, a deeper layer underneath of the epidermal layer, but expected sending messages to keratinocyte and dermal layers to tell skin cells what they're supposed to do, maintain healthy and young looking skin. So I just want to clarify certain terms used in cosmetic industry. Penetration and permeation and absorption. These are all three different. Skincare ingredients penetrate stratum corneum and possibly permeate into a little further down to the bottom of epidermal layer. In the meantime, pharmaceutical, like a steroid, is designed to absorb into dermis, where collagen, elastin, or structural fiber is located, and also blood vessels and nervous system, and gets on the bloodstream to spread in the body to do their job. The important role of this skincare product is to prevent moisture loss and to protect from environmental insults such as UV radiation, bacteria, pollution, and other stimuli. So that's the roles of cosmetic products. So knowing this skin physiology, we formulated and designed Celavive product play its role. And we now have 11 products, but it will be 15 products with a brightening product line introduced soon. So the first basic line is for everyone. There are makeup remover, foam cleanser, milk cleanser, toner, day lotion, day cream, and night gel, night cream. The purposes of basic line is cleanse, protect, and nourish everyone's skin to keep the strong barrier function. On the other hand, specific skincare lines, products, more take aggressive approaches to fight over premature skin aging. And now new brightening line is obviously designed to support, make skin tone even and glow. So the skin is generally categorized into 4 types. Normal skin is very ideal with a balanced moisture level and less visible pores. Dry skin tends to react some skincare products because it can be flaky and easily irritated due to impaired skin barrier. The extreme version of dry skin can be sensitive. Oily skin feels especially oily around midday and has a slightly better natural sun protection, but it's also prone to acne. Combination skin means you have a dryness on your cheek, but the oiliness primarily on your T-zone, the forehead and nose area. And then one more skin type is mature skin. Really need to focus on preventive measures to slow down premature skin aging. However, it is true that even though the same person, the skin conditions changes by age, seasons, climate, hormonal changes, diet, and mental and physical stress, and so on. Sometimes it makes more sense to choose right Celavive product based on your current skin condition. So we are talking about cell signaling complex. So what is it? So we apply the same concept of USANA nutritional intelligence to their topical applications. That is called Celavive cell signaling complex or Celavive intelligence complex. It is a blend of 2 botanical extracts and 2 small peptides. Southernwood extract, coffee seed extract, hexapeptide 48 hydrochloride, and palmitoyl tripeptide 38. They are formulated in a different ratio depending on the particular Celavive product in order to do their jobs and show maximum benefit in the skin. They are all innovative raw materials from all over the world. They were tested in vitro, ex vivo, and in vivo with the human. So they are scientifically proven substances. These small molecules actually bind the skin cells receptors to turn on and off, which is to synthesize beneficial substances, leading to the healthy skin. Okay, so the latest Celavive product is exfoliating scrub and mask, containing 100% natural, non-abrasive, biodegradable, unique exfoliating agent made of glucomannan, which is derived from konjac potato. How does it work? The surface of glucomannan particles swells water in the formula to become soft hydrogel layer, which are designed to absorb dirt, excess sebum, and impurities while gently massaging. The elastic core balls remains to work as a scrub agent to remove the stubborn dead skin cells and makeup. Once the absorbed surface is removed with the massage friction, the new surface appears to repeat the process. The particles are easily rinsed off with water. Because it's such a gentle scrub agent, it works well acne-prone skin and those who are struggling with some skin trouble. We recommend it using 2 to 3 times a week, but can be used in a daily cleansing, providing brighter and more radiant looking skin with a smooth after feel. And don't forget the black color came from bamboo charcoal, which also help absorbing impurities synergistically with the hydrogel form. There are another remarkable ingredients called benoidarm. It is originated from a planktonic microorganism obtained from Brittany area coastline in France. The key active ingredient is N-acetylglucosamine. So glucosamine reduces cell adhesion and disrupt coniocyte bond, helping gentle exfoliation. Remember, stratum corneum is made of very tough keratin proteins cemented by lipids. Benoidarm supports to cut the bond and remove the dead skin cells. This material also works at hydrating skin. That is why we suggest leave the scrub formula on the face after exfoliating at least 2 to 5 minutes after gentle exfoliation. It has a double function, therefore we call scrub and mask. In addition, take a look at the left graph. By treatment with benoidarm, 28 days, the cell renewal rate is doubled in just 1 week compared to untreated skin. Also, study shows at the right graph, photo reduces number of pores by 40% in 28 days, and the total surface of pores are reduced by up to 58%, and pores become less visible with its astringent effect. It is pretty good product formulated in this Celavive mask. Okay, now we are talking about new product line, brightening series. This is a brand new upcoming product line. I heard many associates have been waiting for a brightening line, and they are including dark spot corrector, luminous cream, and light complexion serum, and vivid white mask. They are containing all established brightening, well-established brightening active ingredients like niacinamide. Through the line, all product contains niacinamide. And at least one or two, the latest innovative ingredients in each product. Let's take a look at the basic brightening mechanism first, quickly before introducing each product. So this diagram on your left, melanin pigments are synthesized through several chemical reactions in a skin cell. We start with tyrosine, one of the amino acid, and then convert it to dopa and dopaquinone. And finally, melanin pigments are produced. Then discoloration appears on the skin surface after a certain period of time. But the melanin synthesis never occurs without tyrosinase, which is an enzyme to convert tyrosine to dopa and dopaquinone. All Celavive products, brightening product contains niacinamide because it blocks tyrosinase at the very beginning of this melanogenesis cascade. Niacinamide has been studied many years, known as an effective tyrosinase inhibitor. That is one mechanism of on your right picture, you can see melanocyte at the bottom produce melanosome, which contains a lot of melanin pigments. This melanosome becomes mature. They start releasing to the upper layers melanin pigments to the upper layers. Again, niacinamide would suppress melanosome to releasing melanin pigments. This is another mechanism of skin discoloration. So in Korea and Japan, I think in Korea, niacinamide is categorized as a functional ingredient in a brightening product for these reasons. Okay, the first product is dark spot corrector. It contains very powerful vitamin C called ascorbyl tetraisobutylpalmitate. It is very stable and oil-soluble vitamin C, and also known as one of the highest penetrating vitamin C today. The cross-section of the skin cells on your left photo, you can see the melanocytes sit on the bottom with spider legs, like a figure called dendrites. Melanin pigments produced in the melanocyte and transported to the upper epidermal layers through this spider legs dendrites. With this ascorbyl tetraisobutylpalmitate, niacinamide, and aspergillus ferment, another brightening product, works synergistically to inhibit both tyrosinase activity and melanosome transport. And over time, it could reduce the skin's melanin production and then also lighten the existing hyperpigmented spot as well. With many scientific researches in Japan, Korea, ascorbyl tetraisobutylpalmitate is also categorized as a quasi-drug and functional ingredients. And therefore, the upper limit in cosmetics use is set up to 3% and 2% respectively. We can't formulate more than that concentration. And furthermore, ascorbyl tetraisopalumitate demonstrated increasing collagen synthesis and prevent lipid oxidation in the vitro study. This is a bonus to apply this, to use this product. Okay, now we are talking about luminous moisture cream. So what do we have in this luminous cream? Yes, we formulated saccharide isomerate, which is a unique combination of sugar and amino acid, which inhibits hyperpigmentation, which is induced by inflammation this time. Also prevent transport melanosome again to the dendrite. On the right drawing, melanin production is increased by not only direct UV radiation, but also induced by expression of COX-2. COX-2 expression is actually induced by environmental stimuli, such as UV radiation, air pollution. A saccharide isomerate prevents COX-2 expression by suppressing inflammation. So this is a relatively new approach to the brightening product today, and I'm excited to introduce this luminous cream to try. The left 3 photo also shows the efficacy of saccharide isomerate. The left photo shows normal skin cells, not so much pigment. A middle photo shows hyperpigmentation conditions, increasing melanin production. A very by 134%. And then after 2 weeks, with the 1% saccharide isomerate, the hyperpigmentation was suppressed only by 25%. So it shows great efficacy of saccharide isomerate. The one more powerful brightening ingredient in this formula is ascorbyl glucoside. This is another stable form of vitamin C combined with glucose. After penetrating into skin, this ascorbyl glucoside breaks down to pure vitamin C, working as a very strong antioxidant. Ascorbyl glucoside plus niacinamide is a viable combination to work very well as a brightening agent. So the next product is light complexion serum. So what's in this light complexion serum? Angelica actilova root extract. It is very interesting material which demonstrates new brightening mechanism. This extract activates perception of a protease enzyme, and they digest membrane of melanosome, which is a bag of melanin, and disperse the melanin in the cells becomes invisible to the eye. Take a look at the 3 stories Petri dish on your right. It is mimicking epidermal layer. In the bottom Petri dish, you can see dark spot, which is supposed to be dense melanin at the bottom of epidermis. In the middle Petri dish, melanin pigments are nicely dispersed in water. And then the top Petri dish, there's no melanin, but just water to compare to other 2 Petri. So when you see this 3-story Petri dish from the side, you can recognize melanin pigment bottom 2 Petri dish clearly. But when you see the stacked Petri dish from above, you can see through the dense melanin pigment, but it becomes invisible when you shake the Petri dish. Yes, very interesting materials. One, it is kind of optical illusion. You cannot see melanin pigments by dispersing. This is really, really interesting. And one more well-researched brightening agent is licorice root extract. It blocks a signaling pathway for inflammation, and one of the key substance in extract, licorice extract is called glabridin. This one helps make skin tone even by inhibiting tyrosine. So the last brightening product is a vivid white mask. This one has Palmaria palmata extract containing a lot of oligosaccharide. Is unique to our mask. It is obtained from the red algae. Palmaria palmata controls photo-induced pigmentation by inhibiting tyrosinase activity again and transport melanosomes. The photo is the culture of skin tissues with immunocytofluorescence method to clearly to see melanosome and melanocyte. On your left photo, skin cells are irradiated by UVB radiation. So you can see many melanosomes are released. It's a rounded, the round green stuff, melanosome. In the right photo, with 0.5% Palmaria palmata extract, you cannot find the melanosome because it's inhibited, tyrosinase activity. So we recommend this vivid white mask 2 to 3 times a week to treat age spot, freckles, or brown spot induced by chronic sun exposure. All brightening products are a global formula, so all markets have the same formula. It was quite challenging to select brightening agent to comply with global regulatory requirements. So I hope you can see the expected result by using this new brightening, potent brightening product series altogether. So now I want to quickly introduce Celavive clinical study. So the Celavive line was developed for healthy barrier function and anti-aging. In the last year, we conducted clinical trial for Celavive skincare product with regimen for both dry skin and oil combination skin at the third-party laboratory called Stephens and Associates of Texas in the U.S. to evaluate this product performance. The used products were Gentle Daily Cleanser, Perfecting Toner, Protective Day Cream, Replenishing Night Cream, Vitalizing Serum, Hydrating Eye Essence, and then Scrub and Mask for dry, sensitive skin. For oily combination skin, they use the same except instead of milk cleanser, we use the foam cleanser and day lotion, nitro gel. And then also we look at this result at the single center clinical study, assessed efficacy and tolerance of Celavive product. The total of 50 subjects completed study participation with 25 subjects in each regimen. Women with moderate overall photo damage face used Celavive product for 8 weeks. Clinical evaluation was conducted at the first visit, week 4 and week 8. Subjects participated clinical grading efficacy parameters such as wrinkles, crow's feet, fine lines, skin tone evenness, hyperpigmentation, firmness, and overall skin appearance like healthy glow on the whole face. It was very comprehensive. So overall, result from the clinical trial indicated the Celavive facial regimen products were effective, improving facial skin condition when used for 8 weeks with the subject under conditions of this test. Result of the clinical grading of efficacy parameters show satisfactory and significant improvement in fine lines, appearance of pores, smoothness, softness, radiance, clarity, firmness, overall skin appearance on the face at the week 4 and 8. Wrinkles and crow's feet a little bit challenging. Also hyperpigmentation on the face, but the 8 weeks when compared to baseline post-regimen come out with a very good result. Additionally, there are satisfactory significant improvement from baseline in smoothness, skin tone, evenness at week 4 and 8 for dry skin, and then same kind of result at week 8 for oily combination skin. So this slide shows self-assessment questionnaires and some digital image using Vizia CR photo station. In this self-assessment, statistically significant improvement was recognized when compared with baseline. So skin feels nourished, feels deeply cleansed and purified, fresh, feels soft and supple, and skin looks vibrant, glowing, and skin's texture looks smooth and even, and feels smooth, clear, translucent, and pores appear small after 4 and 8 weeks in both skin regimen when compared with the baseline. Digital images were taken of each subject face, left, center, and right views. The top 2 photos shows redness. Rosacea possibly becomes less redness from left to right. And the bottom 2 photos shows pigmentation of her cheek became lighter when you look at from left to right. Okay, this is going to be my last slide, and this is a preview of future product development. We are currently working on 2 skincare products. Fine. One is mineral sunscreen. As many of you already know, Hawaii states will ban on the sales of sunscreen containing oxybenzone and octinoxate. And these 2 are very common, safe, effective UV filters against both UVB and UVA radiation. 70 to 80% sunscreen products in the US contain these 2 UV filters. However, some environmental researchers have connected about harming, concerned about harming coral reef, talking about ocean environment. Oxybenzone might treat coral, and octinoxate might kill baby coral. This new rule will kick in 2021, and some movement already has started. So we decided to develop a new sunscreen with UV scanners, which is not same as UV filters, but something UV light reflected on the skin, and use materials like zinc oxide and titanium dioxide for more choices for our USANA associates. So we'll make it multifunctional mineral sunscreen with anti-pollution and anti-blue light. So it is going to be a very useful and beneficial sunscreen product. And another developing product is postbiotic skincare product. This will be very different from the current Celavive product line, but more therapeutic for super dry skin for certain skin dermatitis condition. So postbiotics, just so you know, doesn't contain live bacteria, but it's a metabolite such as vitamins, acids, and small proteins, which are very beneficial for skin barrier function. So those who are struggling with some skin dermatitis, most likely a skin barrier was damaged, and therefore it gets irritated, have a trouble. So we are still reviewing various research papers to find the best active ingredient or combination and explore a better delivery system and base formula to maximize the benefit. So please look forward to those new innovative products in near futures. So thank you very much for listening to me, and this is all my presentation today night.
Thank you, Kay John, for discussing to us how Celavive works on our skin. And of course, we are excited to try out the future product development on mineral sunscreen and postbiotic skincare line. And since we still have time, is it okay with you if you will answer some questions given to us by some of the associates?
Yes.
Okay, so first question, which product do you recommend to control acne or pimples?
Yeah, that's a difficult one. And as a skincare product in cosmetic categories, I can recommend to use the foam cleanser and then toner. Excuse me. So the foam cleanser is a soap, and then it's a pretty, can I say, gentle foam cleanser, gentle foam soap, excuse me, but still it's a very superior actually to get rid of excess sebum. So rather than using milk cleanser, I recommend to use foam cleanser to get rid of excess sebum first, and then give you enough moisture, hydration actually, using toner, and then put the moisturizer after that, and then make sure before you go to bed, you really need to cleanse your face first, and then tone for the after use gentle cleansing.
Thank you, Kay John. So you've heard it from her. She recommended foam cleanser, toner, and cream. So it's
Yes.
you can use those products. Okay, another question. Are these products allowed to use for pregnant women or lactating women?
So we, as far as I understand, and talking to scientists in our group, there is no dangerous, ingredients for those pregnant women in our formula. Sometimes retinol is questioned, in using pregnant women, but we don't have any retinol in our formula. So we should be okay. But if you really concerned about that, I recommend to talk to your doctor. Talk to your doctor.
Okay, so what she said is that our products do not contain retinol, which is that product is not good for the pregnant women. So the best recommendation is to seek assistance or advice from physician
Yes.
if is it okay to use the
Yes.
products that we have.
Yes.
Okay.
Yes. Our products don't contain any retinol,
Okay.
so it should be okay. Yeah.
Okay, thank you. And for this third question, what is the proper application of brightening line products so we can maximize the effects, such as the brightening serum, dark spots corrector, and luminous cream?
Mm-hmm. So it depending on the person's expectation actually and concerns, priority. If you really have a dark spot and concerned about the age spot and dark spot, quite frankly, this is the most difficult one to remove it. So I recommend use dark spot remover first, and then the rest of two actually use before you go to bed. So while you are sleeping, that skin turnover actually get more activated, and then hopefully those three products. Actually, each product we put the clinical dosage of active ingredients as much as we can. So by using three products, it should be very strong, powerful, brightening efficacy is expected. But because of that, some people feels irritations sometimes. If that happens, I want you to try one by one to see which combination is actually good for your skin and to see the expected result. But like I said, this is very high potent brightening agent concentration in each product. So I see that the expected result, like clinical study, we did 4 to 8 weeks. Some people shows result in 4 weeks. Some people takes a little longer, but also some people did some irritation too. So that time, please use. Don't give up. Don't give up all products, but use maybe one by one to see how it works for you.
Okay, thank you, Kay John. So what I've understood is that the three products that mentioned on the question, they have powerful ingredients. So you can use that before going to bed. And of course, I believe it's important to have proper time of sleep so that you
Yes.
can really have again the morning.
Yes, and then also you can use it in the morning,
And
daytime too. But please make sure you wear sunscreen product
okay,
so that your skin doesn't have some kind of irritation and burning kind of sensation.
okay.
Yeah.
And then and then you said that if there would be skin irritation, it would be best to try out one product at a time. Okay.
Yes, unless you are very confident your skin, you don't have any problem with vitamin C and other extract, then you can use all together.
Okay. Thank you, Keijan. How about this question? I am currently using the gray line of Celavive and wants to introduce the brightening series to my routine. How do you suggest I incorporate the brightening series to my routine? So she's trying to incorporate the brightening series along with the gray products.
Yes, there are some questions like that. But I have talking to marketing people to make sure, the usage and directions, consistent message from company. But I'm always suggesting the people to use what is your priority, what is your high concerns. Like I said, if it's hyperpigmentations, or make sure your skin tone's even, then I want you to use brightening product first. But then if you are concerned about anti-aging overall or tightening your skin, or you're concerned about wrinkles around eye areas, I recommend use those first. And it's really up to the the users, priority in terms of their concerns.
Okay, thank you, Kay John. So, what I've learned from that is that you will use the product based on what you really need or what you want to prioritize. So, if you have hyperpigmentation, you can choose the brightening series line of
Mhm.
products, or if you want to, you're dealing with your wrinkles or aging problems with your skin, then you can use the gray line of products.
Yes,
And
and right, obviously, you can't probably use everything. It's too many.
yes.
Yeah. So you have to kind of choose, what you want to do. Also, you can do it one categories in the evening and another categories in the morning. Uh, so you can kind of elaborate, how you want to use it depending on your highest concern of the skin.
Okay. Thank you. Another question, is it safe for teens to use Celavive products like the foam cleanser
Is it safe to use foam cleanser
for the teens?
for the what? Excuse
For
me,
the
I'm sorry.
teenagers. Is it safe
Teenagers.
for the teenagers to use the
Oh,
foam cleanser?
yeah, I think so. When you look at the ingredients and formulation, there's nothing wrong for the teenager. Um, as long as, but I want you to try, first a little bit, not the whole face, because some people get really, uh, it's not just a CeraVe product, but in general, cosmetics. We tested RIPT, which is allergic reaction, and uh, some kind of skin detrimental, effect on the skin. And our all CeraVe product has this RIPT testing. So I think this is good for teenager too. But we recommend to use a little bit, not the whole face, but maybe for arms or like the neck, to try a little bit and make sure there's no reaction.
Okay, so it's good to use the foam cleanser as long as we should try it first on a small area of our skin so that we
Mhm.
will know if the user is allergic to the product or not. So that's a good
Yes,
recommendation. Okay,
yes,
so
yes.
few more questions. Are we still good, Kjon?
Mm-hmm.
Okay, so another. When I use dark spot remover, I immediately apply vitalizing serum. Doesn't it remove the dark spot remover from the part where I want it to work when I do that?
No, so when you apply dark spot remover first, it goes into, we just talk about penetrate into the stratum corneum, outermost layer, superficial layers of skin immediately. So after you apply serum over dark spot remover, it's actually good. It's kind of capped, that the active ingredients in a stratum corneum, and then possibly permeate, into the deeper skin layers, which is actually help, to reduce uh, hyperpigmentation. So it's good. It's not going to dilute dark spot remover formula.
Okay, thank you. Another, this may be a funny question. Uh, um, but is it true that our skincare line is safe? That it's okay to taste?
Um, our skincare line is safe and it's okay to
To taste them?
taste. Taste?
Yes. Yes.
No, it's safe for skin, but don't taste or don't eat. It's not meant to be ingestible. So uh, simply, it's topical applications after ingestion.
Yes.
So don't taste it or don't eat it.
Yes, that's right. So these products are for topical applications. So please, please, everyone, don't try to taste it or or ingest any of it. So it's not safe. Okay, when you take it inside. Okay, so another. I think this would be the last question. What are the recommended products for men?
Yeah, so that's another question I have been asked recently. So the men's skin is a bit different from woman's skin or age over 40 or 45. But the difference is men's skin is more oily, more sebaceous gland. So I recommend to use oily combination as skincare line, but especially I learned that some men actually use makeup remover to remove not the makeup but excess sebum and sweat, and then they use foam cleanser and then apply toner after that. So if the person is really oily, I kind of recommend foam cleanser and toner and the moisturizer day or night. Day lotion at the daytime protect against radiation, and then night gel for evening. But like I said, some men use makeup remover to remove, the stubborn sebum and impurity first. That's interesting to hear that, but some men do that.
Okay. Thank you, K. John, for that.